My name is Sunshine, and this is Everyday Sunshine. Today, I wanted to do an update on my experience with Kisqali and Letrozole, two breast cancer medications that I started taking a month ago. A little bit about me and my journey with breast cancer. I was initially diagnosed in July of 2018 with stage 1A ER/PR positive, HER2 negative breast cancer. I had surgery in October of 2018 to remove the lump, at which point they biopsied my auxiliary lymph node and it was negative. I was very early stage 1. Chemo was not recommended for me at the time because of the type of cancer that I had, how early stage it was, and the benefit that it would have given me was negligible. It decreased my risk of recurrence by less than 1%. So I did a lumpectomy. I did 35 rounds of radiation and was declared cancer-free. My prognosis was 97% survival at 10 years. I considered myself incredibly lucky and went on about my life. I didn't really do a lot of soul searching at that point, or I didn't really change much because it was such an early diagnosis. I don't know if I was just in denial about how serious it was. I'm sure that I was traumatized, and it's 44th time. I was relatively young to have been diagnosed with cancer. They kept telling me it was very early stage. My prognosis was excellent. I just didn't really give it the consideration that I should have. Fast forward to 2024. I felt a lump in my neck. I went home and Googled it, knew what was coming. I went to see an ENT because I thought that since it was neck, it must have been a different kind of cancer. It couldn't have been breast cancer because why would breast cancer be there? I went for a CT scan. They could not confirm what it was. I had it removed. He also removed a lymph node in this area at the same time and, of course, sent it out for pathology. It came back as metastatic breast cancer, which I don't know why I didn't expect that, because it was in my neck. So my next step was to go for a PET scan. I had a PET scan. It was negative. I had a PET scan. I had an MRI to make sure there was nothing in my brain. And she wanted a breast MRI because it could pick up smaller things that the mammogram couldn't. And she wanted a brain MRI because a PET scan does not scan the brain. She just wanted to rule out any other areas of concern. So my brain MRI and my breast MRI were clear, which is fantastic news. My PET scan was clear. My mammogram was clear. There is no sign of cancer anywhere else in my body at this moment. So in September of this year, Kisqali was approved for early stage breast cancer. Now, I am not exactly early stage, but I'm also not stage 4. I'm stage 3. I am stage 3 because it did spread to my lymph node, the nearest lymph node. The rest of my body is clear at this point. So the doctor recommended that I do Kisqali for 3 years, or as long as I can take it, and Letrozole for 5 to 10 years. This video is to update you on how those medications are affecting me. And I am sorry for that very, very long intro, but I wanted to let everybody know where I'm at. I am making this video in case anybody else out there is facing this same treatment or facing a breast cancer diagnosis and you are scared and you don't know where to go and you don't know what to do. I want to be a resource for you because I have been through it twice and I want to share my journey with you. I'll give you a touchstone of a point of reference for what you can expect. And everybody's journey on these medications is different. So I am going to share my experience. However, it might be different from your experience, your friend's experience, your neighbors. This is mine. And the more information that we have out there and the more different experiences that we have for reference, the better. Because when I was given this protocol, I couldn't find any resources, really. Anybody out there that had gone through something similar. It's a very lonely feeling journey, right? Breast cancer. So many women have it, but nobody in my personal life does. I am hoping to be that point of reference for someone. So let's get into it. I started Letrozole, which is an aromatase inhibitor, in September of this year, late September. I immediately noticed side effects from that medication. However, they were really not severe. My side effects from Letrozole were hot flashes. They weren't severe hot flashes, though. It would be like I'm just living my life and all of a sudden I get really hot. but it would pass very quickly. It wasn't a severe hot flash. They were waking me up at night. I would wake up just like so hot and have to throw all the covers off of me and get my dogs off of me and just be like, oh, it's so hot. And then it would pass within a minute or two. So it didn't really affect me. The next side effect that I experienced from letrozole was achiness, pain. I don't even really know how to describe it other than just a general soreness when I stand up or get up in the morning. Anytime that I am moving after sitting still for a long time, I have a little bit of ache, and it takes me a couple of minutes of moving for that to go away, but it does go away. It's not a constant pain. It's not anything I even notice unless I've been sitting. After filming this video, when I stand up, I'll be a little sore. And as soon as I get moving, it will stop. I've also experienced more hair shedding since starting letrozole. Letrozole completely inhibits your estrogen production. So I went from having too much estrogen, which is why I had positive cancer twice, to having none. And that it did affect me. My hair is shedding a lot more than normal. I'm hoping that stops. It's not extreme. It's not like clumps of hair coming out. It feels weird to be a cancer patient and talk about shedding when so many people they have chemo and they've lost all of their hair. But I'm just talking about the side effects of the treatments that I'm doing in case anybody else out there is doing this exact plan. So hair shedding more than normal. It hasn't become noticeable to my eye. Like I don't notice a difference in the density of my hair. However, I just notice when I brush my hair, there's more hair in the brush. So hot flashes, general aches and pains, and hair shedding are my side effects with letrozole. I have not had any digestive issues. I mean, that's it. Those are my only side effects. I consider myself very lucky. I keep a gratitude journal, and I have written down more than once that I am so grateful that my side effects on these medications have not been worse. That's letrozole. I started that before Kisqali. Kisqali I started 3 weeks ago, but the way that Kisqali is dosed is you take it for 21 days and then you have 7 days off. That's considered one cycle. The goal for me is 36 of those. However, when you take Kisqali, you have to be monitored very closely for liver toxicity and heart damage. Those are the two major side effects, and lung damage is a little less common, but it can happen. Before I started Kisqali, I had to go in for lab work and an EKG to make sure that my heart function was normal and to get a baseline for my liver and kidney function. My blood work was fantastic. I have been very fortunate. I am, outside of cancer, a very healthy person. And what I mean by that is I don't have any pre-existing conditions, right? Like I don't have diabetes, I'm not obese, I don't have arthritis, I don't have any health issues, any immune disorders, anything outside of cancer. So my blood work, my lab work is fantastic. I also live a very healthy lifestyle. I will get into that a little bit more later. So you get an EKG, you get lab work, and then you're given the approval to start Kisqali. And then in 2 weeks, you have to go back for another EKG and more lab work to make sure that you're tolerating the Kisqali. I went back on Monday of 18th and had my 2 week, which was really 2.5, almost 3 week EKG and lab work. EKG was perfect and my lab work was perfect. I am very grateful. I was able to complete my first cycle of Kisqali with no negative side effects. Now, side effects. Have I experienced any side effects from Kisqali? No, I have not experienced a single side effect. I cannot tell any difference since adding the Kisqali to the letrozole from before when I wasn't taking Kisqali. I have not noticed anything. I have had no stomach upset, no digestive issues, no sleep disturbances. My hot flashes are less. I don't even notice them anymore. I maybe get 1 or 2 a day, maybe like 1 a day and 1 at night. I haven't noticed any more hair shedding. I haven't noticed any side effects whatsoever. So if you have been presented with the option to take Kisqali, I encourage you to try it. I can't say that you will not have any side effects. I'm just saying that I have. And I'm so grateful for that. All of my side effects have been from letrozole. I haven't really experienced anything different since adding in the I do have to go back again next week or in 2 weeks. So that will be, it's about a week and a half from now, from the time that I'm filming this video. We'll have to go back and have my blood drawn again to check again my liver and kidney function. The first 3 cycles, I have to be monitored every 2 weeks with labs and once a month with an EKG. After that, I will be considered okay to take this medication long term. I will be monitored once a month. If it gets to the point where my labs aren't looking great, then I would cut the dosage. So the dosage for me, my dosage is 400 milligrams a day. That's 2 pills. I'll show you how they come. So they come in these little sleeves. You get 3 of these sleeves. Each of these sleeves is a week. And then you have your daily dose. So, it says Monday, Tuesday, Wednesday, Thursday, whatever. I didn't start mine on a Monday. I started on a Friday. So I will start my next pack next Friday, my off week. So next Friday, I will take Friday, Saturday, Sunday, and I will go through until that is done. And that 3 weeks is another cycle. My goal is to get 36 because that does reduce your risk of recurrence by about 30%. The only problem with this medication is that it can damage, again, your heart, your liver, and your kidneys. I just have to be monitored to make sure that that's not the case. So I hope that helps somebody there. And I will continue to do these updates after every cycle and let everybody know, any changes or updates. If there's anything new to report, if I develop any new or worsening symptoms, I will report back so that it can be a reference for anybody else out there. If you have been diagnosed with breast cancer, my advice to you, first of all, don't panic. That's number 1. Breathe. Do everything you can to take care of yourself. And I not only mean eating well, which is super important. You've got to eat well. You've got to cut out the things that cause cancer to grow. You've got to give yourself the best shot. You've got to move your body. Get out there, move your body. I Googled fat lump and knew what it was. I started moving my body. I walked 7 miles a day. I started doing yoga. I started meditating. I started reading. I started keeping a gratitude journal. I started deciding to make the most of every single day because you don't know, cancer diagnosis or not, if you're going to be here tomorrow. All you have is this moment, right? You can't worry about the future. You can't predict it. I can't predict it. I am happy, healthy, and whole. My family is happy, healthy, and whole. I am loved and supported, and I have everything that I need. That's what matters. I can't change the past. I can't predict the future. I live in the here and the now, in this moment. My next piece of advice for you is to become an expert in your type of cancer. Read everything that you can. Study, research, learn it. It's important. Don't trust that the medical industry is going to always know exactly what is best for you. In my case, I had to get a second opinion. I just didn't feel right about the first proposed treatment plan for me. It just didn't feel right. It was something in my gut, something in everything in me was telling me that this was wrong. And I'm glad that I found another way because at this moment, I am tolerating it very well. And I'm so happy that I am able to do this and still be able to function, work, and care for my daughter and take care of my home and my pets and, everybody that depends on me. I can still do that because these medications are allowing me to do that, to live a normal life. I'm grateful every day. Next piece of advice for you would be to start practicing gratitude. I know that sounds crazy and I know it's so hard right now, but do it. Start practicing gratitude. Right now, think of 3 things that you're grateful for. It can be anything. It can be mine. Number 1 on my list a lot of days is the shining sun. When the sun is out, I'm so happy. Or a good meal that evening, or, clean socks, a warm blanket. It doesn't have to be big things because dealing with a big thing, right? But there are so many little things to be grateful for, and I'm grateful for all of them. My next piece of advice is to forgive yourself. And to for anything that you've done in the past that you're holding on to, anything that you're carrying, any regrets, any pain that you are clinging to and carrying around with you, let it go. You've got to let it go. You've got to release anything that is weighing you down. It's not yours anymore. Set it down. Leave it by the road. Bye-bye. Peace out. I'm in my healing era. Anybody that has harmed you, forgive them. It's not worth it to carry this with you. There is such an emotional aspect to breast cancer. I feel like my first go round, I healed my body. I did not heal my soul or my spirit or my mind or my heart. And that's what I'm focusing on this time. And I feel so much better. I feel better now than I have I can't even tell you the last time. I'm 51 years old. I feel fantastic. I very strong, very active. I'm eating well. My headspace is clear. My mental state is very clear. I'm trying to radiate joy and love. It's part of the reason why I started this channel, right? Was just to try to give back in some way, to try to be helpful and connect with people and be a face that you could come to and know that I'm going to be here if you need me. And if you are going through something similar, please feel free to reach out. Please. More than happy to connect to you, to be a sounding board. And I'll leave you with this. Please take care of yourself. It is important. Take care of yourself like your life depends on it, because it does. And if you don't care for yourself, you cannot care for everybody that depends on you, because you won't be here. So take this as a time period in your life to put yourself first, to prioritize self-care. That does not mean to be selfish. That means to care for yourself, really love yourself, right? Do things that are actively loving yourself, whatever that may be. For me, it's meditation. It's morning walks. It's evening walks. It's peace and quiet. It's journaling. It's reading a book. It looks like many things that don't cost anything. Okay? Take care of yourself. I will see you again next month with an update. In the meantime, I'll be back with more beauty content, because that is what brings me joy. And I like talking about pretty things. So I'll see you next time, guys. Bye.